Hello, everyone. Welcome to Kids Mental Health Pierce County November webinar, Emotion-Focused Family Therapy, Tools for Connection and Confident Communication. I'm so excited to have our partners join us here today. I'm going to give it a moment, let everyone trickle in here. My name is Vanessa Adams, and I am the program coordinator for Kids Mental Health Pierce County. I am excited to present Dr. Allison Chase here, who's here with us, and Dr. Natalie Goodwin. They both join us from Dr. Chase is a senior clinical advisor for Eating Recovery Center and Pathlight Mood and Anxiety Center. Her areas of specialization include child and adolescent mental health, the treatment of eating disorders, and parental training and education, and family or team-based therapy, including advanced training and emotion-focused family therapy. She is a certified eating disorder specialist supervisor, and her experience spans over 25 years in the field of eating disorder and mental health treatment. In addition, she offers training and ongoing education for other professionals across the United States and workshops for professionals, community organizations, and schools. I'm very excited to also have Natalie Goodwin here with us. And Natalie was initially going to be our sole presenter, and she was joined by Dr. Allison Chase due to feeling under the weather, and she did not want to have to cough through, or if her voice gave out, didn't know if she could speak for the full hour. So I'm so grateful that Dr. Goodwin also joined us, feeling under the weather, and her colleague, Dr. Allison Chase, was also here. Excuse me. Dr. Natalie Goodwin is a native Seattleite who loves living in the Pacific Northwest and taking advantage of all natural beauty has to offer. She left for a short period of time to journey to the South for graduate training and received her PhD in clinical psychology from the University of Alabama. Completed pre-doctoral internship and postdoctoral fellowship at Baylor College of Medicine in Houston, Texas. I'm really excited for all of the expertise and knowledge that they both have to offer. They are trained and specialize in this, and we've had lots of requests from schools, from community mental health partners, from hospital staff, and other folks in this arena. So we're just really excited. I'm going to turn it over to Dr. Goodwin and Dr. Chase to get us started.
Great, thank you.
Thank you all for being here today, and I want to send out a special thank you to Dr. Chase for helping partner with me in this, since my voice is a little bit iffy today. I'm going to go over the first couple of slides just to give y'all a little bit of an idea of our programs, and then we'll talk about how EFFT fits in with those programs. So nationally, we have several sites that offer full spectrum of level of care. That means that we offer in Eating Recovery Center, we offer virtual IOP, PHP, residential, and inpatient. In Washington, the only level of care we don't have is inpatient. We treat ages 8 and up, all genders. Sometimes I like to just throw in what makes us a little bit different from other programs. So we're physician-led. We have an amazing team of physicians that really help hold our teams and carry out our treatment programs. We also have multidisciplinary teams. We have lots of different folks that represent our treatment teams and provide their input and their skills, dietitians, therapists, program therapists, lots of support. Also, we are able to do NG tubes in residential. That's not very common in the residential world. So because we're physician-led, we're able to do those NG tubes to help kids hopefully stay a little bit closer to home rather than going to some of the inpatient sites that are further away, to try to support them to get the nutrition that they need. And we have really strong emphasis on evidence-based treatments. You can see them all listed there. I won't shout them out. But we're very passionate about trying to offer treatments that show some efficacy in the research environment. And strong emphasis on family caregiver involvement. So next slide, I'm going to go over just the Pathlight levels of care. So Dr. Chase, if you'll proceed one forward.
My apologies.
No worries. So Pathlight Mood and Anxiety, again, full spectrum of level of care. We treat ages 12 and up. Within Washington, we have Res, PHP, IOP, VIOP. We are housed in the First Hill area in Seattle. Also have a strong physician team, offer lots of evidence-based treatments, and still continue to emphasize strong family and caregiver involvement. Next slide. So caregiver involvement at ERC Pathlights. So we have a very strong belief in getting caregivers involved. We really want them to feel like they know how to support their loved ones, and we want their loved ones to feel like they can get support they need from their caregivers. So our child and adolescent programs for Eating Recovery Center, we use emotion-focused family therapy in partnership with family-based treatment as it can apply to higher levels of care. We do 2 family sessions a week for RES and PHP kiddos, and at least 1 family session a week for IOP. For Pathlight, we also work towards 1 to 2 sessions a week for RES and PHP that are focused on family, and then IOP session is usually kind of mixed at that level of care for that program. I know this is a kid group, and I want to mention also for our adult programs, we still believe in family involvement, and so we shoot towards, in our Eating Recovery Center programs, we shoot towards 1 to 2 family sessions a week for RES and PHP patients, and IOP tends to be mixed, and Pathlight's about the same. So we really want our staff to have very specific training in family therapy. We feel like it's a foundational skill for our therapist team. We want them to know how to involve caregivers. We want them to be increasing that support that our patients have for when they discharge, so that they have a solid team and a solid level of support. So I'm going to turn it over to Dr. Chase at this time, who's going to do the overview of EFFT. And then at the end, Dr. Chase has to leave us a little bit early, and I'll answer any questions that come up around 10:45 our time.
And just quickly, while you were speaking, Dr. Goodwin, I took a look at the question answer asking about when kind of discharge happens and what sets the parameters. So something you may want to look at and address later. I think important to know is everything that we decide on is really a team-based effort, right? With our medical staff, our therapists, our dietary, as it all comes together, in addition to insurance company as well. They're another partner of us in the process. And so we all really work together to be able to make the best recommendations in order to move forward towards recovery and success. So Dr. Goodwin can further answer that as well. But I have the wonderful opportunity of talking to you all about emotion-focused family therapy. Now, I want to let you all know, as I'm looking at our time today, I'm going to run through this fairly quickly. Some of our presentations last 3 hours, 6 hours, couple days, just because this treatment modality is, it's so incredible and it's so effective, and it has a number of different parts and pieces. So please know that you're just going to get the overview today. And if there's further information you need or talks you want, Dr. Goodwin is your local go-to. So that's what's great. So first and foremost, we make sure families know and hear from us that we understand that they are doing plenty of good things that are working, right? And when that's the case, we want you to keep doing it. We understand, first and foremost, families are not to blame for eating disorders or mental health disorders. That is a ridiculous, unfortunate myth that started decades ago and has thankfully been discredited with all the research and all that we know, both with the research and clinically. So we know there are a lot of things that are working, and we want you to keep doing those. We also understand that oftentimes caregivers are not prepared or don't have the skills or knowledge of how to handle something so complex and challenging like an eating disorder, like mental health disorders. And because of that, we want to have parents and families involved because actually they're part of the solution, not the problem, right? So why do we involve caregivers? Because of the power that exists between the kind of the neurobiology, this is what neuroscience teaches us, between the caregiver and the child as well. And so, or it can be a young adult, it can be a spouse, it can be others. That's the beauty of emotion-focused family therapy. I know we're focusing on children, adolescents right now. We do use it across the lifespan, across one's lifespan. So keeping that in mind. So in a nutshell, when you have neurobiology so connected, it of course makes sense that that's what we're going to use. In addition, it allows us to have a multitude of like understanding and perspective of what's going on with the loved one suffering from an eating disorder or mental health disorder. And so by bringing in the family, it gives us more information to understand maintaining factors, contributing factors, and an opportunity to pull those caregivers in to create all this incredible support in order to increase the intensity of treatment and make it even more productive. So that's sort of our why in a nutshell of why we involve families. And then the other part, as I indicated earlier, that we understand very much how an eating disorder, a mental health disorder can really disrupt a family. It can disrupt an entire system, right? And so given that that's the case, we recognize that when our patients come to us, we are not necessarily seeing a family system or a support system that's in its best state, right? It's been reorganized, and we understand that. And we understand that that's why the help and support is needed. And so we look at it as being our job to help, to support, to bring things back to where they need to be. So recognizing all those parts and pieces is so important. We also see caregivers as taking a very active role, not just our support individuals on our team, but actually a really active role in leading or co-leading a lot of these interventions that we help to teach and provide, both behaviorally and also emotion focused. And, you know, especially given our higher levels of care for patients that are in treatment with us, sometimes it's a phone call or a FaceTime or a text or email, video. It's not always in person, but that's okay because there are a number of ways in which to support. The primary reason or the goal, what the caregiver is aiming to provide, is a way to reduce symptoms, all those really unhealthy symptoms that are existing to maintain the eating disorder, the mental health disorder. In addition to reducing symptoms, we also get to help the loved one to really increase their skill and confidence. Their skill and confidence with dealing with emotions. That's what underlies these mental health conditions. That's what underlies eating disorders. A way to think about eating disorders is it's really about mismanaged emotions, right? Ways that there's all this discomfort and emotion, and the eating disorder becomes this way to navigate it. Now, mind you, a super unhealthy way, which is why we need to do something about it. So one of the things that we spend time working on is to help the caregiver, help our patients as well, and really help the caregiver understand the role that self-efficacy plays. We call it emotion self-efficacy, believing in the ability to be able to manage and handle emotions in a productive way. And it's really, really important and powerful. And we happen to know from the research that so many caregivers don't feel very confident in being able to do that. You know, so many caregivers are understandably worried that they're going to do something wrong or make it worse. And we'll hear this all the time. It's never gone well in the past. Why do you want me involved? Well, we want you involved because we need you involved, because you are the incredible support person for your loved one. And we know you can do it. It's about providing you with some skills to do it. So what happens in a nutshell with what we call low self-efficacy? So self-efficacy in itself as a definition is really the ability to believe that you can handle something or take care of it or be successful in the end, right? So the idea is our level of self-efficacy contributes to our outcome. One of the things that we know happens with many of our patients, the loved ones that are out there, is that they don't like feeling uncomfortable, right? So if they don't like feeling uncomfortable, the easiest way in the moment to manage that is actually to avoid it. Just like caregivers too. I don't like feeling uncomfortable and try to help support or push my loved one, so I'm going to avoid that too. The problem with avoidance and avoiding emotions is that it may momentarily feel better, but in the end, it is not getting us to where we need to be. So the more that you avoid emotions, the less capable you recognize that you are with dealing with emotions, right? So emotion avoidance leads to low self-efficacy with avoidance. It leads to a belief that I can't handle it. And so what happens is That belief exists. So then you end up kind of keeping that pattern going of using really unhealthy coping behaviors like eating disorder behaviors, like self-harm, like a number of the other really unhealthy strategies, use of substance, etc., that end up coming up. And it really creates this really unhealthy pattern of behavior because you use all these unhealthy ways of coping, and then some painful experience happens and emotion comes up and you want to avoid it again, and the cycle just continues. Again, all problematic. Well, what we're going to talk about today, when we talk about the skill of emotion coaching combined with behavior coaching as well, is that we actually want to kind of change that pattern around. We want to take it from emotional avoidance to being able to provide really targeted emotional support. So we're not engaging in emotion avoidance anymore. Our loved ones are not engaging in emotion avoidance. They are actually able to stay in and tolerate and challenge the emotion. And when you do that, you recognize that I can handle this and I can do it. So we're increasing the self-efficacy in the process. If you increase the self-efficacy and your belief in being able to handle emotions, the great news is you don't need to do all those really maladaptive or unhealthy coping behaviors or strategies anymore. So we're really looking to change the pattern, and that's what the goal is. And this, I want to take just kind of a step back as I'm going to launch into some of the strategies of emotion-focused family therapy. It really came out of recognizing that, yes, there are many patients suffering from mental health disorders as well as eating disorders that have very low self-efficacy in their functioning and emotion coping, but we've realized that caregivers do as well. In particular, when caregivers have higher levels of fear or anxiety, as well as self-blame, those are the big ones. When those exist, what the end result is caregivers don't feel very empowered or able to or willing to as much engage in helping to support their loved ones. And as a result, you can imagine the constant problematic behaviors that come up for the loved one. So this is clearly was a challenge. So what EFFT did was it kind of came in and said, we need to create some strategies in which we can help the caregivers increase their self-efficacy and become empowered. And what they found was, in the research that was done, when there was that caregiver empowerment that was put in there, those fears and the self-blame, which did exist, what happened was when you add empowerment to it, you were able to engage the caregiver in a way that they felt so much more confident in doing. And as a result, they could provide the needed emotional support. And as a result, we saw symptoms like the eating disorder symptoms, like the restriction and the purging, as well as the other negative behaviors. We saw it interrupted and we saw improvement. So that's really the goal of this intervention, right? Is to really reduce the caregiver fear and self-blame. And in that process, that is done by really increasing empowerment to be able to help teach and support caregivers to be able to focus on those recovery-focused behaviors. So I'm going to talk about how we provide emotional support and behavioral support. And then we're also going to talk about a very interesting component, what we refer to as emotion blocks as well. But taking a minute to jump into something called healing wounds. One of the things EFFT has not only come to understand how we can support the caregiver to help support their loved one, but it's about how we do it. It's about how to create that connection and that emotional support so that we can help that one suffering from an eating disorder in moving forward. And one of the ways that is done is something called a therapeutic apology. It's a little bit of a confusing term because it sounds like it's going to be an apology as if one caregiver is to blame in some way. And that's not what it actually is. Therapeutic apologies are not about saying, I am to blame, I did something. They're actually a way to work with your loved one to say, I really understand you and I want to share in the burden. I understand how difficult this process is in navigating your eating disorder and all of the emotions that you have. And I wanna help you hold on to some of it. You know, the patients that are suffering from an eating disorder and mental health disorder, they're pretty, let's call it like bogged down, shall we say, by all these intense emotions, right? That it can be really challenging to keep working and pushing through. Well, what a therapeutic apology does is it allows the caregiver to kind of come in there and say, you know what, let me hold on to some of that for you. Let me hold on to some of that emotion and that burden of the pain. I want to let you know how much I deeply understand how hurt you are, how, you know, what a sort of negative experience you had, how you're feeling. It actually becomes a therapeutic strategy, which can be very, very powerful. So it's part of the treatment and one that can make a world of difference. So moving over to talk about how we provide this emotional support that I mentioned earlier in learning how to be more empowered as a caregiver. So first and foremost, let's just talk for a second about emotions, right? Emotions are a very physiological process. They are a bodily felt sensation, whether it's one of elation or happiness, we could feel that, as well as frustration, depression, anxiety, right? Our body gets revved up in a number of ways. So whenever we have these bodily responses that are happening, we know that it's also connected to a way in which our body needs to be brought into balance. That is the ultimate thing about our bodies. They do like balance, right? So we have to find some way to balance out this intense feeling. And we do that with whatever need it is, right? If one is very depressed and sad, the need could be kind of comfort, ways in which to help them, to support them, right? If somebody is so angry and frustrated, the need could be kind of running through the emotions and being able to better learn how to tolerate them. So the bodily cues are really important. The other thing that's really important to recognize is emotions aren't all bad, and I want to make that part clear. I think sometimes we kind of misinterpret that to be the case. Emotions are actually very necessary. They're necessary for our survival. It's actually emotions is the thing that like gets you out of the way when you're about to step off a curb and a bus is headed your direction, right? And next thing you know, you're back on the curb. Your heart may be beating really fast. Your palms all sweaty, but you're actually safe. Well, that was because that where the emotions are centered, that fight or flight part of your brain, it got activated and it took care of that. And so we are thankful that we have that system. The problem is for many and many suffering with mental health disorders is that their fight or flight system isn't always in a true alarm system. It actually ends up being more like a false alarm, which is really a problem. So what do we do with all this? How do we provide emotional support when we have very physiological needs and arousal and like getting it all to kind of calm down and help to process the emotion and support it? Well, we have figured out how we can navigate how our brain works around all this, right? So remember that fight or flight system that I was just describing to you, the system that gets things going? Well, that's your limbic system. And in there is a part of the brain called the amygdala that really is responsible for like not only holding those tough emotions, right? But actually they're part of basic functioning that we do. It's very primitive. It's very reactive. It's almost, and you can see it's very close to where the brainstem is near the spinal cord, very much like a stimulus response system. So a lot of reactions, a lot of impulses, like involuntary functions, like breathing and blinking and all of those things. And the strong emotions, the intensity of the emotions that come up. I mean, just think about it. Think about when we all have our own emotional reactions. That's our downstairs brain that's up and working. Well, the lovely thing is that, and what makes us humans, right, is that we actually have an upstairs brain that actually we get to balance that out with, thank goodness. So, and what's amazing is that upstairs brain can be really, really powerful in calming down that downstairs brain that's so reactive. And so For adults, those over the age of 25, their prefrontal cortex, that much more complex, sophisticated area of the brain, is doing its work. And I mentioned 25 because that is unfortunately the age in which we see a fully developed frontal lobe, which is why, particularly for children and adolescents, we really need those caregivers to step in to help navigate that, just because there's not that sophistication. So that prefrontal cortex with decision making and empathy and self-reflection, all those important things. So what the goal is with emotion coaching as part of EFFT is actually to help teach caregivers, clinicians as well, but to help teach caregivers how to help their loved ones to create that bridge, right? That loved one has got that patient, that kid has got that amygdala that's all over the place, right? And the prefrontal cortex, not so much. But if the caregiver can come in and help to activate that prefrontal cortex a little bit more and use theirs to help activate it, it really creates a bridge to help the emotional support and conditioning, which just can be so powerful. And the reason why it's so important, particularly with our patients or eating disorder patients, is because we have all of these super feelers. And what is that? It's somebody who feels emotion very deeply and very intensely. Super feelers are like genetically wired that way, right? It's a combination, like most things today, of the genetic and that wiring combined with the environmental kind of an early childhood experience that occurred. But the result is you end up with a super feeler. And a super feeler is one, I mean, think about the patients or the loved ones that are suffering from an eating disorder. They tend to be very attuned into their environment. They're almost like sponges for taking in all that's going on, and they take it in and they hold it and they experience it very intensely, much more sensitive to perceived threats. And what's really hard is so many of the super feelers, they actually really want to kind of like hide this part of themselves. I think they feel like they're very different from others because of how intensely they are feeling and they're experiencing things, which also explains why many super feelers actually try to kind of navigate their environment around in some way, not because they're looking to caretake everybody, but really they're looking to actually take care of themselves, because if they can calm down their environment, they're going to feel better. So it's really important to think about this as far as sort of how super feelers go. And we always make note of this for those that are in the caring profession that are out there. Would not be surprising if you might be a super feeler too. There is absolutely nothing wrong with super feelers at all. They're actually wonderful, caring human beings. And it's really important to help them to learn how to regulate because things are so intense. So how do we do that? We do that with a skill called emotion coaching that I'm going to take you through right now. Now, keep in mind, we could spend hours talking about emotion coaching and practicing and what to do, but I'm going to give you kind of a brief overview. And, if you'd like additional information, we can talk about that later. Emotion coaching has two key steps to it. The first one is validation, right? Validation means really understanding and proving that you understand that you really get what's going on with somebody. And then step two is where we provide the emotional and the practical support. And I will tell you, step two is usually not very challenging for most. Who doesn't like to provide reassurance or solve a problem, right? It's step one that usually needs the most help and support and work. So with that said, let's think about this for a minute. So validation, and I will have many caregivers tell me all the time, of course I validate. And I'll say, okay, what do you tend to say? And the response is, well, if my child's come home really upset from school, I'll say I can understand why you might be feeling so upset, coming home from school right now. And then I'll say, yes, okay, then what comes next? And what do you think happens? That's what you hear next. Well, then I say, but you're home now. And so let's go get you, let's go spend some time together and hang out. Okay. So you have validated, you've told them that you've understood they've had a really hard day in school. And then you've actually invalidated by saying the but part. You've said, but I'm really not going to kind of go there with how you're feeling. We're just going to try to solve it. And the issue with this is that in order to work through the emotions and the uncomfortable feelings, one has to really stay in the emotions. It's kind of like a little bit of a emotion roller coaster, if you want to say that. Like, you got to stay in it for it to move its whole effect. So how do we keep somebody in their emotions? We're changing that but, and we're changing it to because. And not just one because, but actually 3 becauses. When you use the becauses, you say, I really understand why you're feeling that way, right? So instead, what you end up saying is, oh, I can completely understand that, you've had a really tough day in school today, because I know you weren't feeling so great when you left this morning. And because I remember you told me you had 3 different tests today. And because I know you've had some conflict with a friend of yours, and I bet that made the day really hard. You have said that I really get it. You've kept them in that emotion to work through that emotion. It is so powerful, and it's so powerful to do. The becauses can be challenging when you're first trying it out and when you're first starting it, but you would be amazed at how quickly, with practice, you can sort of attain those becauses. And sometimes your becauses aren't completely on target, and that's okay too. You just keep trying those becauses. You will know when you can get more on target. So you've done the becauses, right? I understand how you might feel that way and feel all the describing the emotion and all the becauses. So the idea is you've sat through their emotion has come down, and now you get to do the kind of support that they're looking for, providing comfort, understanding, some communication of togetherness, or it's going to be okay, right? We provide that emotional support, and then we get into the part which most caregivers actually really love to do, which is fix and solve the problem. So you can say, let's go, take a walk. Let's go play with the dogs. Let's go work on challenging ourselves to have that snack after school, which I know has been so uncomfortable for you. Whatever the case may be, then you get to come in and work on doing it. So really important to utilize the piece of validating in order to run through the emotions, which then opens the door to be able to really support in a way. Think how much more powerful support is when emotions have been brought down. And so emotion coaching really can help with the de-escalation. It can help with the regulation of emotions and really help one to resist urges and negative behavior. And so our ultimate goal here is to be able to help support the caregiver, whether it's a parent, a spouse, a friend, the caregiver, to be able to help support their loved one. And then what our hope is that over time, the loved one, the patient that's experienced the eating disorder, the mental health disorder, will be able to take this in and be able to then self-regulate themselves, and being able to do that, a very, very powerful skill to be able to do that. So yes, we've helped the loved one by emotion coaching, but the beautiful thing is we've actually, in addition, been able to help the caregiver as well, because the good news is that when caregivers are engaging in emotion coaching, there's brain changes happening. There's actually the release of oxytocin, which is a hormone in the brain that allows for more connection and creates connection. So a lot of wonderful things come from it, the connection and also the calming. So keep that in mind. It's so beneficial. So that's emotional support. Let's just chat for a quick minute about how you provide behavioral support. Behavior support, or becoming a behavior coach, is really equally important to becoming an emotion coach. You have to know the skills of emotion coaching because they're going to accompany the behavior coaching part. But the behavior coaching part is really important because the caregiver really needs to help their loved one that is engaging in unhealthy and maladaptive behaviors associated with their mental health disorder. We've got to interrupt those symptoms. We've got to change their behaviors. We have got to decrease the restriction of behavior, or the purging, or maybe it's the self-harm or the school avoidance, all the things. We need to have a shift in that. And that happens behaviorally with being able to coach. So we need to help give caregivers these skills to like regulate themselves as well, which is what we use the emotion coaching for, right? As well as to be able to help to shift in all those unhealthy behaviors. So what we're really looking for is we want a caregiver to be able to respond, right, to their loved ones at a time when they're not overwhelmed and stressed and all those things, which is often what happens when a loved one is having a really hard time, right? We want to get them to a place where actually they can function more like when they're nice and relaxed, even when they're not. So how do we go about doing that, right? We help the caregiver recognize like what is it, which of the behaviors are really causing the most impairment or the most dangerous, right? What do they need to get on track with wellness? If you take an eating disorder patient suffering from anorexia nervosa, what do they need to do? They need to consume nutrition, right? They need to eat food, their intake. So that would be an example of the behavior we want to help the caregiver to do. So we have this lovely little sort of roadmap, shall we say, a little path that that we highly suggest that can be really effective to use with behavior coaching, right? When we want, for instance, the example I used, we are going to support our loved one, our 12-year-old suffering from anorexia nervosa. We're going to look to help her to make it through a meal, right? So the first thing you want to do if you are a caregiver is make sure you are calm. And simple, slow breathing for, I'm not kidding, 5-10 seconds can be very powerful in calming down that central nervous system, that downstairs brain, really, really helpful. So are you calm and are your expectations reasonable? We always need to ask that. And in the case here, the example we're using, yes, there's a clear meal plan and it needs to be followed. Then the next part of this is actually just to take a couple minutes to connect, right? About something, I don't know, whether you're talking about the lovely weather out there. I don't know how Seattle's looking these days, but the lovely weather that's out there, or the dog that's in the room, or something of enjoyment, right? And to just do those 2 minutes just creates a little bit of that collaboration, really important. And then here is sort of the highlighted part. And I highlight this because this is often the part that is more challenging, right? It's about delivering a command, right? It's making a request, delivering a command. It's not asking a question. It is saying, please do something. I need you to complete your meal today. I need you to please finish that other half of the sandwich. The key is paying attention to the tone of your voice and your posture. We're going to aim for very direct and what I like to refer to as calm confidence in how we put it out there, right? Also very concise. We don't want to give them a list of all the reasons why they have to cooperate or over talk it or over energize it, right? We just want to keep it very clear and calm. You make the request and then you should be prepared. So oftentimes resistance is going to happen. The loved one is going to say, no, I'm not eating this sandwich. It makes me uncomfortable. I don't need to, whatever the case may be. So that's where you get to turn on that emotion coaching skill. Say, I can understand why you're not wanting to eat the rest of your sandwich, because you're feeling so full, because you've been eating more food, and because I know you're in our home setting, we're not in the treatment program anymore, and because sometimes it's hard to listen to the things that I'm asking you to do when you feel so uncomfortable. Right? We have validated. And then you can go in to make that request again. And I need you to eat that half a sandwich. So that would be an example. That is being a behavior coach. That is working on shifting and changing these behaviors that aren't very helpful and that are often dangerous. Now, one of the things that we know about being a behavior coach is that it can be super uncomfortable. It's not easy. It's not easy being a caregiver and asking your loved one to do something that's making them so uncomfortable. And we get that. And what we see so often is caregivers have all kinds of different ways in which they respond to their loved ones. And we've come to better understanding, and we'll often use like animal metaphors in which to describe it, because I think it's something that everybody can really hold on to. But it becomes really important in understanding if you are at times doing something that's not as helpful, right? So we ask caregivers to look at your emotional style. When you are, making the request, using our earlier example, having your loved one finish that lunch when they are incredibly uncomfortable and just came out of a higher level of care treatment, what happens for you, right? Are you more like the jellyfish? Are you like, I can't believe I can't eat right now? Are you, and you find yourself like all over the place with emotion, like a jellyfish would be transparent? Or maybe you're more like the ostrich, where you're like, okay, we're not going to talk about this. We're not going to deal with it. I'm going to put my head in the sand, right? Those are two different types of emotion styles that we will see in caregivers. And here's the problem is that one is too much emotion, right? And then one ends up being not quite enough emotion, right? Because we need to work through the emotions. So what we talk to caregivers about is, how can you achieve that St. Bernard? How can you respond in a way that is warm and that is caring, but that provides that containment and that sort of confidence in your warmth with emotion? Again, where we're trying to get and what we're trying to do. So there's emotional styles when we are talking about how we support our loved ones. And then there's also behavioral styles. So pointing out to families, to caregivers, to loved ones, that we also understand that it's very easy to go into like a behavioral mode when you can be challenged by your loved one and what's happening in treatment and with their disorder. So we challenge them to say, if you're more like that kangaroo, do you just want to put that loved one in that pouch and hold them and carry them around and not let anything happen to them? Or is your style much more like the rhino? Do you just want to tell them to charge ahead, do what needs to be done, and not listen to anything else, right? You can, these fall on ends, and you don't necessarily have to be exactly on one end or the other, but what do you tend to lean towards? And what we want to help caregivers to better understand is that we really need to move towards kind of a middle place, right? Too much control, too much direction is not very helpful. And definitely too much caretaking where you take over, it's not helping them either, because they're not learning how to manage or navigate behaviors or emotions. So that's why we are always encouraging one to think about how the dolphin raises their calf. They do this beautiful job of being able to be in charge, but they have a nice way of allowing for a little more independence, letting their calf go, staying close enough by to scoop in if needed, and also being able to give them some room to see how independent they can be. So very important to keep in mind. These are the patterns and the sort of the tendencies that we are aiming for, the St. Bernard and the dolphin, to kind of find that balance in that place. And we often understand that is not what exists right away, right? So that's why we spend so much time working with caregivers to help them do this. And one of the ways in which we do this is actually by using something called a caregiver traps scale, something we use in our treatment facilities. And we have our therapists work with our caregivers to better identify and understand what may be the things that are sometimes getting in the way of them being able to navigate the treatment process. We also point out that it is very normal and it makes so much sense that would be the case, right? So we have them kind of take a look at the kind of things that are getting in the way. And what we find is that caregiver trap scale kind of translates to these kind of key behaviors and engagement that caregivers are involved in, right? It's sort of at the top of the tree there, right? Accommodating, enabling. It would make sense that that child starts to cry and have a tantrum and say they can't finish their sentence, and they feel so like it's so much that maybe that mom would say, okay, we don't have to worry about it right now. We'll just try. We'll try again tomorrow. Well, that's accommodating and that's enabling, because what's happened is we know now that nutrition that is so necessary has now not gotten into that child, which is a problem, right? That would be one example. So there are these behaviors that exist, and they exist all the time. The great news is that one of the sort of underpinnings of emotion-focused family therapy is understanding that that behavior is not only so normal, but it exists for a very good reason. It exists because caregivers are human beings with very powerful feelings as well. Caregivers are experiencing that fear, that shame, that self-blame, that mother that is so overwhelmed, right? So fearful that if she pushes her child to finish that other half of the sandwich, is maybe your child's going to go run off and hurt themselves. Maybe that's what's happened in the past. Whatever it may be, one's own and caregiver's emotions can get the best. Just like if we look at this tree here, right? What happens at the roots of the tree, what gives into the roots is what creates those branches and those leaves that we see, right? So we understand it is one's underlying emotions, the caregiver themselves, that is contributing to what we're seeing. So that's why emotional support and understanding emotion is so key and paramount to helping caregivers and helping their loved ones, those patients that are suffering with mental health disorders. So with that said, I'm gonna be wrapping us up. I know I went through this all quite quickly. There's so much to say about it. It's such an incredible use of strategies and approach. And one of the things I'm going to leave you with is holding on to the fact that while we want to always see huge leaps and bounds and changes, there's a philosophy of emotion-focused family therapy that I have come to really appreciate and hold on to. And that's this idea of 1 degree. And I know 1 degree doesn't often look like much or feel like much. You know, if you put in your little coordinates, you're like, okay, what's the difference between this and moving 1 degree? Probably nothing. Well, just a little bit at that moment. But the interesting thing is, if you put in your coordinates and you move 1 degree on a compass and you keep going and you keep going, you actually find that you get quite far from where you started. And it's something to hold on to and remember too, that what looks like it may just be a little change, a small impact, never underestimate how small it is, because it can make a huge difference down the road. So we are always supporting and so thrilled with whatever it is that caregivers can take and put in their toolbox and learn to help and support loved ones. So with that said, I'm going to turn it over to Dr. Goodwin. And thank you so much. I'm sure you've got some questions coming up.
Thank you, Dr.
Thank you,
Chase,
Dr. Chase.
so much.
I'm going to go ahead and just give it a moment. If you have questions for Dr. Goodwin, you can put them into the chat there. I did see there was a question, can you go back to the last slide? And I wasn't able to see which slide that was necessarily. So if you had more information, possibly Dr. Goodwin or Dr. Chase could share their slide deck to be distributed out or shared further. And then possibly, Dr. Goodwin, you could answer what the threshold is for discharge or what that looks like.
So I tried to take note of which slide it was, and I think it was, this one. So if whoever asked that question, if you can just pipe in and let me know if that's the right one, I would be happy to. I hope I can change it if I need to. So in terms of criteria for discharge, so for discharge completely from our program, meaning that they finished all the levels of care that we were maybe hoping for from them, what we're wanting to see from the eating disorder side, we're really wanting to see, weight restoration based on their growth curve and their very unique body shape and size and style. But also definitely the behavioral piece. So we don't want to discharge someone who has been able to just kind of do behaviorally what we've asked of them. We really want them to feel confident leaving our facility that they can continue their recovery process. And sometimes that means the caregivers feel ready to help their children, their loved ones, support their recovery process. So, when we're working with kids with eating disorders, we want, as much as we possibly can with the time that we get for insurance coverage or whatnot, we want that that patient to leave our care feeling like their caregivers know how to support them in maintaining their nutrition state and their emotional state, as well as feeling like the kid themselves is in a better place. Um, so we're really looking at it from a bigger picture of, we've got all these skills that we're really honing in on the emotional management to try to help the loved one really try to manage their emotions a little bit better. And we're teaching the parents those skills too. So yes, of course, we want somebody to get weight restored because there's so much evidence that when someone is malnourished, it's really hard to use the skills. And so we want them to get that nourishment so that their brain is functioning and can use the skills. And, we also want them to have other components of their treatment process too.
Thank you. I'm not seeing an answer to that question about this slide, and I really appreciate that clarification on what discharge looks like and the consideration of that 1 degree, right? The 1 degree is so huge, and I really love that, and I'm definitely going to hold on to that because sometimes as providers or family members or just humans, it's hard to acknowledge, like when you don't see the big giant change. But definitely seeing that the 1 degree of change puts you on a whole different trajectory, and the outcome long term down the road with all those skills can be hugely impactful. So I'm going to tuck that one into my memory for just working with young folks and families.
It's so important, Vanessa, because I think I give this presentation at our family days. We have family days once a month for our programs, and so often, usually there's at least one parent every time that's like, you can just see it on their face that are like, oh my gosh, I haven't been doing these things. What does that mean about me as a parent? And, another component of emotion focused family therapy is this idea that these are advanced caregiver skills. So they're not necessarily things that you would need if you have, kids that are doing really well and don't have mental health struggles. But if you do have a kid that's really struggling in those areas, this is a set of advanced caregiver skills that's above and beyond kind of normal parenting. And that really helps parents to understand that, like, it's not that they should have known this stuff. It's that, this is really above and beyond. And I think that also leads to that, like, 1 degree of change, because so many parents, especially those ones that are a little more perfectionistic or like really, really want to make sure they're doing what they're supposed to be doing, they kind of take on this idea that they need to have a huge 360, degree change in the way that they're approaching their loved ones. And so really reminding them that, like, hey, these are advanced caregiver skills and we're working on 1 degree right now. Let's get 1 degree of change and see where that leads us.
And I think that likely removes a lot of the pressure and stress from some of those caregiver components, and just recognizing what they're doing well. One component that I really appreciate about emotion focused family therapy is that a real big component of kids' mental health, Pierce County, it's not a one person issue, and it's not a one person solution. It requires community, it requires family, it requires fictive kin, family members, community partners, engagement to really provide the support that one person might need, right? So the eating disorders impacting not just one person, but a family system and other folks as well. So I just really appreciated all the information that both you and Dr. Chase shared today. I learned a lot. I hope that other folks learned a lot. This will be recorded. This has been recorded, and it will be shared on our website to share with others. So if anyone has additional questions, you can email them to me, and I can connect with Dr. Goodwin or Dr. Chase and kind of see what information we can continue to provide. I did have a question around what's the best way to make referrals for both programs.
So referrals, thank you all for your very nice reactions. So referrals would be, if you go to our website, the best way to refer to us is to, there's an admission line on both the ERC and the Pathlight websites. And those admission lines are housed by folks that are in mental health, and they will talk to a family or a loved one, a patient, about what's going on for them and do a pretty thorough assessment. And then provide some recommendations about levels of care. And Betsy, I don't know if you want to say anything more about that. Betsy Malm is also here. She's our professional relations liaison, and she also can very much help providers, find the routes that they need to take for this.
Happy to comment on that. And Vanessa, I was going to put the referral phone number in the chat. Are we able to share that out, or would it be better to? Great.
Absolutely.
Yeah, so I will put that phone number in the chat for folks. And this is all assessments are done, they're complimentary, and there's no obligation. It's really, so it can be helpful to just kind of get a level set to decide where somebody's at and what their needs are, whether it's outpatient or higher levels of care. Does that help?
Yeah, thank you, Betsy. I see one more question in the chat is, could you email a copy of the slides separate from the recording? And that Natalie, I'm not sure if you're able to do that.
Yeah, let me just, I think that's probably fine, but
Okay.
I'll just do a little bit of checking around that.
Okay, so we won't promise that, but we will have the recording that has information from the slides that you could always refer back to if Dr. Goodwin is unable to do so. So again, I just want to thank you both for sharing your time and all of this really valuable information. Thank you to the Kids Mental Health Pierce County community. Just so appreciative of the desire to impact and support youth and families in our community, and the consistent support and collaboration that we see here in Pierce County. So grateful for you. We have another webinar on November 28th, a webinar with Multi-Care and with the YMCA, Reframing Weight Inclusive Care, the impact and resources to support youth. I know this has been hugely impactful for young folks in our community for several years. So really grateful to have you here today. And Lynn asked in the comments, is consultation by phone, in person, or virtual? Betsy.
Yep, so it is all on the phone. So the assessment is on the phone, and consultations all over the phone.
Perfect, thank you. And the phone number is in the chat, 1-877-825-8584. So again, thank you all for coming and sharing this information with us today. We appreciate you. And on behalf of Kids Mental Health Pierce County, I appreciate you all for coming and sharing with us today.
Thank you for having us. Take care.
Thank you.